Hello, I'm Alessandro Bombaci, neurologist of ALS Center in Turin, and I'm presenting a case report of a young man affected by spastic paraplegia, in which we described a new mutation in zinc finger 26 gene. In November 2020, a 56-year-old man was admitted to our department, and he referred a progressive impairment of both legs, especially on the left, and an history of 5 years walking instability. He did not refer any motor impairment at upper limbs, and he did not refer any bulbar or respiratory symptoms. These symptoms presented a progressive evolution, especially during the last years. Anamnesis is not relevant, and there is no familiarity for neurodegenerative diseases. So we proceeded with the neurological examinations, and he observed a spastic gait associated with a light hyposthenia and a hypotrophy on the left leg, associated with brisk reflexes at the lower limb, with a prevalence on the left, no Hoffman, but the presence of Babinski sign on the left. The patient did not refer any intestinal or urinary problems. We proceeded with the examinations. The first were blood examinations, which resulted normal. We also tested the viral and bacterial infections that could provoke the image of the upper motor neuron. We did also an extensive electromyographic, electroneurographic study, in which we did not observe any motor or sensitive conduction alterations, but we observed chronic the image of muscles, especially at lower limbs, as we can see in this figure, which is the exit of the test. We also did MRI of the brain, which resulted normal except for some areas of gliosis, and cervical, where we observed two small hernias, which were not able to describe the symptomatology of the patients because they did not provoke any radicular or medullary compression. And finally, we did also neuropsychological tests, which resulted altered in terms of executive and visuospatial impairments, as we can see from this figure. So, starting from these evidences, we hypothesized an upper motor neuron, a primary upper motor neuron disease, but which one? For that reason, we did also genetic tests. We analyzed both the most important genes involved in ALS that resulted negative, and a panel of genes involved in hereditary spastic paraplegia, and we observed the presence of these VUS in homozygous in a zinc finger gene. This zinc finger is responsible for SPG15, but the the alteration we observed is a novel deletion, never described in literature, but sustained by the presence of this deletion in the splicing site of the gene, and by an in silico evaluation that demonstrated its pathogenic. So in conclusion, we can say that this alteration, this VUS, considering the autosomal recessive transmission, the in silico analysis results, and the clinical presentation of our patient that is superimposable to other patients affected by SPG15, this is a novel mutation described in literature. Thank you for your attention.